Okay, thank you very much, Vanessa, for joining us today. Vanessa is from Balanced Physio and Pilates, and she is my go-to women's health physio that I send all of my clients to whenever they have anything that might crop up in regards to their pelvic floor. So, Vanessa, I'm going to throw over to you initially if you would like to just introduce yourself and tell us a little bit about what you do as a women's health physio.
Yeah, thanks. So I've been kind of treating women with pelvic floor issues maybe for about 10 years now. And in our physio degree, we didn't really cover it too much. We sort of just touched on it. And it was really after I had my first son, and he's about to turn 12, which I was kind of opened up to the world of pelvic floor. And I think, yeah, I'm really interested in it. I love helping women with these issues because often it's simple stuff and education and advice which can really make a big impact in people's lives and their symptoms as well.
Yeah, I agree. And that's kind of why we hooked up to do this talk today, because we had both sort of discussed, I know that you experience and I experience it too, where I have women that I'm working with that, first of all, haven't received any education really around their pelvic floor. And then quite often the question I am asked is, why did no one tell me this sooner? Why haven't I been taught this before? So yeah, it's going to be really interesting to share all the knowledge that you've got.
Yeah, yeah, definitely.
Let's launch straight on in. So I guess the big question is, what is my pelvic floor?
Yeah. So the pelvic floor is simply the floor of the pelvis. So if we use my pelvic model here, so the pelvis is just the ring of these bones, and at the bottom we obviously don't have bone there, and that's just to allow for childbirth in women. So the pelvic floor then is the tissues that form the floor of the pelvis. And if I flip my pelvis up this way, we have, if we're thinking about the muscles of the pelvic floor, we have superficial muscles. So they're the muscles that are closer to the surface of the body. So we have muscles that just come around the opening of the vagina. We have muscles that circle around the anus. But then we have a deeper group of muscles. So if we flip it this way, it's a little bit hard to see with this model, but our deeper layers sit at the bottom of the pelvis, and they kind of form like a little bit of a sling. So these muscles are called our levator ani muscles, and they play a really big role with our pelvic floor function.
Okay, excellent. So why is it important to keep your pelvic floor strong?
Yeah. So just like the muscles in the rest of your body, it's really important to keep these muscles strong because they have a function to play as well. And if we don't keep these muscles strong, then that part of our body, the pelvic floor, might not function as well as it should. And when the pelvic floor is not strong, we might see issues such as stress incontinence, so leaking on coughing or sneezing or jumping or running. We might have issues with urgency or overactive bladder. And that's when you may need to rush to the toilet, or you might even leak trying to get to the toilet on time. We can have issues with the support of the pelvic organs, so that's what we call prolapse. Or you might even have issues with fecal incontinence, so that's the inability to hold in wind or bowel motions.
Okay, and I guess a common thing that people think is, oh, I haven't had a baby, so my pelvic floor is going to be fine, or I had a cesarean, so I won't have pelvic floor issues. But I know that you can have pelvic floor issues or weaknesses or any of the things that you've just mentioned there from it could like through your 20s, you don't necessarily have had to have birthed a baby to have pelvic floor issues. So could you just talk a little bit about that, please?
Yeah, sure. So, no, you don't necessarily have to have. Well, first of all, I guess a lot of people might think that pelvic floor issues might only be when you're 70 or you're 80. But lots of younger people have pelvic floor issues as well, and sometimes it can be related to childbirth or even pregnancy. But we definitely do see a lot of people in their 20s or 30s or whatever age who have never gone through childbirth experience pelvic floor issues. Sometimes in regards to prolapse, they might be like a higher level athlete. They do lots of impact sports and they might have a lack of support around the pelvic floor. We also see a lot of women who have troubles with pelvic floor that is not very good at relaxing, and that could present as a weak pelvic floor. So they might have issues with incontinence, for example, but it's not necessarily because the pelvic floor is weak. So I guess in a lot of people where it's not age related or pregnancy or childbirth related, some of the issues generally we do see is related to a pelvic floor that's not very good at relaxing.
Yeah. So I guess that leads me to the second part of my question around, is a strong pelvic floor always a good pelvic floor? And I guess by when I'm talking about a strong pelvic floor, I'm leaning more towards like a hypertonic pelvic floor or something like that. So
Yeah, yeah. Yeah, so if we think about strong on its own, we could always say a strong pelvic floor is always going to be good. But then you can have something called a hypertonic pelvic floor, or pelvic floor muscles that are not very good at relaxing, which are not very good and can lead to their own set of symptoms. And this is pretty common as well. So, for example, usually through the day, your body, without any sort of conscious effort from you, is going to use the muscles of your body as needed. So, for example, when you cough or sneeze or jump, your brain will engage your pelvic floor, and then when you stop, your brain will relax these muscles again. But in some women, their pelvic floor muscles will sit at kind of a higher baseline level, um, and that can cause its own set of problems. So muscles that sit at a higher baseline level are not very good at functioning either. And women who have issues with this, or issues not relaxing their pelvic floor, might experience leaking, like we said before. Sometimes they might get pain during intercourse. They might and often have issues with pelvic pain. So they might have like lower abdominal pain, groin pain, lower back pain. And they can also have bladder issues and troubles emptying their bowels.
yeah, okay. So could you tell us a little bit, I guess maybe if we move away from that now and then more into the pregnancy side of things, what actually happens to our pelvic floor when we are pregnant, or when we go through childbirth?
Yeah. So when you're pregnant, there's obviously a bigger load on top of the pelvic floor with the weight of a growing baby. But then you also have extra strain because the hormonal changes that happen through pregnancy can make your muscles soften and stretch a little bit more easily. So they're the changes that happen during pregnancy. But if you go on to have a vaginal birth, then the muscles are undergoing like a really big stretch. And they say that these muscles can stretch up to 3 times their length. So that means that after birth, muscles that have stretched, to that degree have a time where they're going to maybe not be functioning optimally, where they have to recover. But also during birth, you can have tearing to the tissues. And, most people kind of hear about that, I guess, during their antenatal classes. And that's where they talk about a grade 1 or a grade 2 tear, which is tearing through those superficial muscles that we spoke about earlier. You can also have a grade 3 or a grade 4 tear, where that tear extends even further and can move into the tissues around the anus or into the anus. But what you might hear less about is you can also tear the deeper muscles of the pelvic floor, those levator muscles that we spoke about. And what happens here is those muscles tear off the bony attachment to the pelvis, and that's what we call an avulsion tear.
Okay. And if those tears occur, how are they fixable? I guess. How would we recover from something
Yeah.
like?
Yeah. So the superficial tears, the ones that are graded, like grade 1 to grade 4, they are usually repaired with stitches. But the avulsion tears, the deeper tears where the muscle can detach from the pelvis, they're not repairable at the moment. There's nothing that they can do to reattach that muscle. And usually it's not often picked up either or given a label. sometimes they might say that you've had like an internal tear.
Yeah.
But yeah, it's something that can be picked up later.
Yeah. Okay. So how about if we have a cesarean? We touched on that a little bit before. Can you still experience, obviously not the tearing, but the weakened pelvic floor?
Yeah, exactly. So you still have the changes, the hormonal changes that happen through pregnancy. So the muscles will still be a little bit more stretched than usual. And then you have the weight of the baby on top of the pelvic floor. So they have shown that, a degree of pelvic floor weakness will exist regardless of what delivery you've had, whether it's a cesarean or a vaginal birth.
Hmm. So I guess in that sense, it's would be quite important, regardless of the type of birth you've had, to see a women's health physio after you've had a birth.
Yeah, definitely. I mean, I think so. And sometimes I think you can have like a degree of weakness without any symptoms. So just because you don't necessarily have any symptoms doesn't always mean that you have a really strong and a well-functioning pelvic floor. So I think sometimes, yeah, there's definitely times during your life, and having a cesarean would be one of them, is where maybe you should just go and have like a bit of a checkup to check up the health of that area and how is it functioning.
Yeah. And I think as a fitness professional, this is certainly one of the reasons why I recommend any ladies, postpartum ladies that are starting exercise with me, come and see a women's health physio, is because, yeah, basically the women's health physio, you're the eyes on the inside. So I can only give cues, but I can't actually see what's going on in there. And I know that if if we don't have those eyes on the inside, then as a fitness professional, I could be getting you to be doing squats or something like that, and that could be impacting the pelvic floor without us realizing, because the client may not be able to feel anything because we're not the eyes on the inside knowing what's going on there.
Yeah, exactly. And we can get so much information from an examination of the pelvic floor. And we kind of touched on it earlier, but often, symptoms of a hypertonic pelvic floor can sound like symptoms of a weak pelvic floor. So without kind of determining, which one is it, sometimes you can also be prescribing the wrong thing for someone without getting that extra information.
Yeah, yeah, yeah. Okay. So let's talk now about the ladies that are not immediately postpartum. So they may have had children years ago, they may have teenage children or even adult children.
Yeah.
Um, but they're suddenly now starting to get a little bit of, well, feel symptoms of some pelvic floor weakness or something's going on with their pelvic floor. Why could that be?
Yeah. Well, I think sometimes, as we kind of spoke about before, is you can have a degree of weakness without any symptoms. So, although these people might report that all of a sudden, this is happening and there's no reason for it, one thing could be is that they've had a degree of weakness and that's kind of only progressed over time to the point then when they have symptoms. But the other thing is that, for example, elder women or women, through the ages of 40 and then that lead up to menopause, they start to have reduction in their estrogen levels. And our estrogen levels are really important to the functioning of the pelvic floor. Um, so that could definitely play part of it. But that also happens, earlier when you're going through your monthly cycle. There's times of reduced estrogen, and often during certain times of your cycle, just before you have your period, you might notice new symptoms like heaviness or leaking that wasn't there before, or is only there, that time of the month. And that's generally the lack of estrogen.
So, for the people that might be experiencing pelvic floor symptoms when they're still in their menstruation years and around that time of their period, would you recommend that they see a women's health physio if they're experiencing symptoms?
I think always because although we're talking about estrogen, there's a variety of factors, and sometimes a little bit of lots of things can cause symptoms. So a lack of estrogen might be causing their symptoms at the time, but they might also have a weaker pelvic floor. So then the lack of estrogen is kind of having a larger effect. Whereas if, they strengthened up their pelvic floor, then a reduction in estrogen might not have as big of a effect and give them the symptoms like they have been having.
Yeah, yeah. So I guess that would be the same for any woman that is going through perimenopause, or even menopause and beyond. Yeah, if they're experiencing any symptoms. Yeah.
Yeah, yeah, yeah.
Yeah. And I
And
think that,
using
yeah, you go.
I was just going to say, and using that time in the lead up of menopause to really
Yes.
create like a strong buffer for yourself by increasing the strength of the pelvic floor. So then during menopause and when you have that reduction of estrogen, you have that buffer there and maybe go through that transition a little more smoother rather than waiting for
Mm.
the symptoms to develop and then seek help.
Yeah, yeah. Okay. So I think that's really good information to know around, definitely if you're feeling any pelvic floor symptoms at any time to seek help. Um, because a common thing that I hear is women talking about, and you don't hear about it until you're in a close circle, and then it might be some friends talking to one another or something, but around how they're experiencing pelvic floor symptoms, and they just think that that's part of life. They just think, having a little wee in their pants whenever they jump or do any physical activity or anything like that. Oh, that's normal. That's just part of getting older.
Yeah.
So it's definitely something that it can be looked at and supported.
Oh yeah, definitely. I think most people think of coming to a pelvic floor physio or addressing pelvic floor issues is always about pelvic floor strength. And whilst that's part of it, there's so many other things that we can do to help. And often it's just teaching you about how that part of your body works, so that you can, I don't know, maybe integrate that into your day. You start to learn a little bit more about fluid intake, all sorts of stuff. Um, but yeah, and there's also other things that we can use as well. So, there's devices that you can use to help stop leaking. Yeah,
Yeah. So it's certainly not something that we just have to put up with and live with the rest of our lives.
definitely not. No.
Good, good. Okay, so let's imagine that I'm a lady now coming in, and I'm seeking help. I've been experiencing some pelvic floor symptoms. So what would happen when I seek help? How does the process happen there?
Yeah. Well, if you're coming to see a pelvic floor physio, then, well, first of all, it's usually quite a long appointment. So it's 45 minutes to an hour. And that's because there's quite a lot to go over and a lot to do. But we spend a lot of time just gathering information. So we talk about your bladder function, your bowel function, obstetric history. So how many babies you've had, what happened during the delivery. We talk about your general health, any other health conditions, and that takes a lot of time just to gather that information. But that helps us create a bit of a picture in our mind about maybe how that area is functioning and what's happening. Um, and then usually, if it's okay with the patient, we do perform a physical examination if it's appropriate for whatever they're coming in with, and that's where we take a look at the pelvic floor. And like we mentioned earlier, you can get so much information by doing that physical examination. And what we do there is we want to see how those muscles are functioning. We want to see, can the person contract their pelvic floor? How strong are those muscles? Is the endurance like? How long can they hold a contraction? We also want to have a look at how well or their ability to relax the muscles, because we've spoken about that can be a really common problem with lots of people. We have a look at the integrity of the muscles because they can be injured during childbirth. We can have a look at the position of the pelvic organs, and that's when we're looking for prolapse. We can have a look at the flexibility of the tissues. There's really so much information that we can get from that physical examination, but just the initial assessment in general, we gather lots of information, and it's very busy and it's very full. But yeah, that's kind of what's involved in our first assessment.
Yeah. So I know for some women, they're a little bit hesitant when they're recommended to see a women's health physio because I think that they are going to have that physical examination and
Yeah,
they might be coming from some birth trauma or some
yeah,
other trauma that has happened in their life where they don't feel comfortable with that
yeah.
happening. So, as a women's health physio, are you still able to provide them with support if, I guess what I'm saying is, does every appointment need to involve that physical examination? Or if a woman's not feeling comfortable, are they still able to get quite a lot out of coming to see a women's health physio without that examination?
Yeah, definitely. I mean, whilst an examination, whilst the physical part of the examination can provide a lot of information, we get a lot of information from the questions that we're asking. And usually I find that gathering information, asking those questions can sometimes take 45 minutes of that hour appointment. So that's really the bulk of the first appointment. But yeah, I mean, all of those questions that we ask are kind of pointing to, could the pelvic floor be weak? Could it be hypertonic? What do we think is happening here? Um, and so there's definitely lots of people where we don't go and do a physical examination and we get them a plan started and we go from there. So it's
Hmm.
not necessary and lots of people don't want it, and that's completely fine.
Yeah. Okay. Well, that's really good to know because that really makes it accessible for anyone.
Yeah,
Yeah, and able to still get a lot of benefit regardless of
yeah,
where they're at.
yeah.
Okay. So now I've got some questions that some clients have actually sent me in
Okay.
that they were keen to find out about. So the first one is uh, can when you've got pelvic floor symptoms going on,
Mhm.
can you do high impact exercise? So, say for example, we've been in to see you, we've been diagnosed with having a weakened pelvic floor, and can we still do jumping and high impact exercises?
Yeah. Did you say a weakened pelvic floor?
Yeah, yeah.
Yeah. Yeah, well, it depends on your pelvic floor problems and like a variety of other factors because the pelvic floor weakness is only ever going to be a part of a whole issue. And for some people, we definitely recommend sticking to lower impact options. Those exercises or movements like jumping, running, skipping, hopping, when we thinking about the pelvic floor, they're definitely considered higher impact. And so for some people, we do recommend lower impact options whilst we build up their pelvic floor strength, and the strength of their legs, for example. For other people, they might be suitable to use a pessary. And so that's a support pessary, something that's inserted into the vagina, which basically gives the pelvic floor its support it needs. And for some people, that works really well, and they can continue on with their higher impact exercise using the pessary meantime.
Yeah. Okay. So I guess it comes down to a very individualized approach. So
Exactly. It's one of
yeah,
those it depends kind of questions.
yeah.
Depends on the
Okay.
person. Yeah.
Um, so you've just mentioned the pessary. So what are
Yeah.
the role of devices that claim to help your pelvic floor? So you've just mentioned, I guess, how the pessary works, but I'm also thinking about I've come across these like chairs that
Oh,
vibrate that say they work
yeah.
your pelvic floor or
Yeah.
something. So what are those? Yeah, like are they
What's
something
out
that
there?
would help more?
Yeah, yeah. I think when you start looking into it, there's so many things out there on the market, and I think they all probably have their own role and can be helpful. Um, yeah, where to start? I mean, there's the chair thing, and that's kind of about electrical stimulation to the pelvic floor. So that's an option. However, personally, I'd probably say like an individualized assessment is always a good place to start as well.
Mm.
You have, if pretty common as well is the LV or the PeriFit, which are what we call biofeedback devices. So they're devices which you insert into the vagina, Bluetooth back to your phone, and it gives you information on your contraction and your relaxation. So they're pretty common and really helpful. because otherwise these are internal muscles that we find it hard to know what's happening without any feedback.
Mm.
What else? You can get pelvic weights, and that's where you're basically like you would add weights to your squats or your bicep curls. You can add weights to the pelvic floor muscles to help kind of boost your strength. We talk about the pessaries. The pessaries are kind of, again, an internal support which can help support the organs. And then you can get other similar devices that you can use when you might have troubles with stress incontinence, so leaking on running. One is the Contiform and the other is called a Cooey. That's a new one. And there are other sort of options that you can insert into the vagina, which just helps give that area a little bit of support so you can continue to do the thing without the symptoms.
Yeah,
There's lots
good.
out.
Yeah, it does sound like there's lots of options there. Yeah.
Yeah, yeah,
Mm. Okay. Um, so let's touch on endometriosis and bladder control there. So is there a correlation there, and are you able to, yeah, do you have anything that you could share around that?
yeah. Well, I think most women with endometriosis, endometriosis can often coexist with the hypertonic or the pelvic floor that has trouble relaxing. And earlier we kind of spoke how pelvic floor that's not very good at relaxing sometimes can be not great at functioning either. And so that might present as bladder control issues. So people with a hypertonic pelvic floor, they might have issues generating strength from those muscles. So then they might have troubles with leaking. Some people with a hypertonic pelvic floor may have troubles emptying their bladder completely. So they might feel like they need to go to the toilet more often. Yeah, they're the two things that kind of come to the front of my mind with bladder
Yeah,
control. That's sort of what you were thinking?
I think so. Yeah, yeah. And when you said that you need to go to the toilet more often, it actually made me think about I don't know if it's a syndrome or whether I've just made it up as a syndrome in my head. But the
Yeah.
whole key in the front door
Yes.
thing. Yeah, is that an actual syndrome? I don't know.
Yeah. So that's called overactive bladder or urgency. And so what happens is there's kind of like abnormal wiring between the brain and the bladder. And some people have these things called triggers. And everyone's trigger can be different, but some common triggers would be key in the front door. What are some hearing running water is another trigger for some people. Some people, the trigger might just be, I think I need to go to the toilet, or is there any toilets around me? And what happens then is, the bladder muscle can spasm a little bit, which can make you feel like you really need to go to the toilet.
Yeah.
And that's what we call urgency or overactive bladder.
Yeah,
What is
okay.
the thing?
And if you're experiencing those things, again, would it be a case of coming in to seeing a women's health physio to talk about what you might be experiencing? Or
Yeah, definitely. It's something that we do an assessment of. Pelvic floor muscles do play a role. And then similar to kind of other conditions, it's not always just the pelvic floor muscles. There's lots of other things we do. We talk about retraining that connection between the bladder and the brain to try and break those triggers. We can teach you ways to get your bladder to relax, so then you don't feel like that urge is so strong. Yeah, so physio does play a role, but often so does medication. Some people go and see their doctor and off to a specialist to get medication for the same issue.
okay.
Yeah.
Yeah, right. Okay. So what would you say normal? I'm going to say normal in little inverted commas there. What would a normal bladder function look like?
Yeah. Well, there's lots of different things, but being able to make it to the toilet without leaking, um, feeling a gradual build up of the urge to go. So unlike what we just spoke about with the urgency, normal bladder function would be having a mild urge of needing to empty your bladder, and then the longer you put that off, the stronger that urge becomes, compared to having no urge to a real desperate. I feel like if I don't get to the toilet, I might have an accident. On the toilet, it's about being able to start the flow of urine straight away. It's about having like a continuous stream and not having pain emptying your bladder. And also it's about not feeling like you have to go back to the toilet after you've just been.
Okay. Yep. Yep.
Yeah.
So, does the bladder or the pelvic floor have anything to do with the amount of times you might need to go to the toilet of a night time? So, if you're finding that you're waking and needing to go to the toilet, is that more a case of someone maybe drinking too much fluid, or could there be a pelvic floor connection going in there?
It can definitely be both. So it can be due to fluid intake. So if you're drinking a lot of fluid in the evening and you're getting up overnight, we usually recommend that you reduce your fluid intake in the couple of hours before bed. It can also have to do with age. So as we get older, beyond the age of 60 to 70, it's normal to have to get up to go to the toilet overnight. And it can also have to do with the pelvic floor. So, for example, a bladder that's you're not completely emptying, or an overactive bladder, like the key in the door kind of issue we were speaking about earlier, or even that overactive pelvic floor could also cause you maybe to get up a little bit more during the night than you should.
Yeah. Okay. All right. Well, thank you. That takes me through all of the list of questions that I had gathered.
Yeah.
Is there anything else that you wanted to add that we may not have covered off today?
Not off the top of my head. I think we kind of touched on most things, which I feel are really important. Yeah, so not off the top
Yeah.
of my head. Yeah.
No worries. I think my biggest take from our conversation today is that a lot of the things that you have mentioned today are things that women are just living with because they don't know any better. Nobody has taught them that, these are not things that you have to live with. They're taboo topics. So nobody walks around telling everyone around them, oh, yeah, I'm wet my pants a little bit, or talking about vaginas or anything like that. So I think, yeah, it's certainly what I've taken from today's conversation is that if you are experiencing any pelvic floor symptoms, it's not necessarily something that you need to live with. It is definitely something that a women's health physio could help you out with and explore further to give you a better quality of life.
Yeah, definitely. I agree. It's something that is so common, but you're right, no one really talks about it. So I think we all need to be a little bit more open, and maybe I know you do a really good job of it, but asking people, I guess, just asking people rather than waiting for them to kind of ask you or tell you is a good place to start in normalizing the conversation. And again, I think that a pelvic floor physio is not just about pelvic floor exercises. There's lots more that we can give you. And if pelvic floor exercises haven't worked for you in the past, this doesn't necessarily mean that nothing will.
Yeah,
Yeah.
yeah. Okay, that's a
Yeah.
really good thing. Yeah, to walk away with too, because I have come across women who I've worked with in the past who have been to see a women's health physio, felt like the exercises they weren't getting anywhere with
Yeah.
those, and just
Yeah.
sort of, oh well, it's not going to work for me.
Yeah.
So I think that's really good to know that yeah, there are other options there too.
Yeah. Yeah. Definitely.
Well, thanks for your time today, Vanessa. For anyone that is listening, would you be able to share where they can find you and find out more about you?
Yeah, so I'm in Vincentia. My business is called Balanced Physiotherapy and Pilates. And if you type that into Google, it should come up with all our contact details, or you can ask Nikki.
Fantastic. And I'll definitely make sure I put links there on my wherever we share this today so that
Okay.
people can access you and book
Yeah.
in if they feel that they need to, yeah, have an assessment done.
Oh, thank you,
All
Nikki.
right. Well, thank you very much.